CDC is tracking the rise of a drug-resistant stomach bug, saying that it now poses a serious public health threat. The bacteria is resistant to a broad range of antibiotics. These strains can also spread their resistance genes to other stomach bugs. Wow. So for more on this, let's bring in CBS News medical contributor Dr. David Agus. Doctor, good morning. So, I mean, I've noticed a number of people getting stomach bugs, over the last month or so. What is this bug, and how can people protect themselves from getting it?
It's got the great name of Shigella, which is a bacteria that causes this stomach flu. It's been seen, in rise. The number of cases that are resistant to our standard antibiotics is going up pretty dramatically. The initial influx of cases was predominantly in gay and bisexual men. It's transmitted by sex, as well as the standard stomach bug by touching food products and touching your mouth and touching other people. But this is one because the bacteria, the antibiotics that treat it are fewer and fewer. The CDC is getting worried.
So, Dr. Agus, let's talk about this news out of Eli Lilly that has just announced that it will cap out of pocket costs for insulin at $35. What are your thoughts about this? Will other pharmaceutical companies follow suit? And I'll point out that in the interview that the head of Eli Lilly did with our Lilia Luciano, he pointed out that Lilly and other pharmaceutical companies are working on other insulin drugs that they say those drugs may not be at the same cap level as the old version of insulin that you're getting. So it makes me wonder, well, okay, if it's easy to say the old stuff is at $35, but the new and improved or better stuff is going to be at whatever price we set at, that's not necessarily great either.
Vlad, you never trust anybody. Trust is a major issue here. So, there are certain drugs that patients are dependent on. Insulin is one of them. People require insulin if you have diabetes. And what we've seen is the prices go up dramatically over the last decade, even though the cost to make it has gone down. So many patients are actually rationing the drug. That is, not even using the correct dose because they can't afford that. They could save money by using a suboptimal dose, and there are health ramifications to that. The White House and political pressure has really pushed. And Lilly said the fourth quarter of this year, so not today, but in the fourth quarter of this year, so in September, October, November, they will lower the cost of insulin by 70%. And that's a big step. I mean, hopefully it will go for the newer versions of insulin. Hopefully it will do other drugs also. Right now, drugs are what we call predatory practice. If there's a drug and you have a disease and you have a drug, you can charge whatever you want, and insurance companies pay. And if people don't have insurance, you have to pay out of pocket. And we really should have some system for value there because these are monopolies. And with monopolies, you could take advantage of people. And I think we've seen that with some of the drug pricing.
All right, so now some questions from the public. And people still want to know about COVID.
Oh, yeah. Still out there.
Yeah, this person asks if monoclonal treatments, I hope I said it right, for COVID-19 are effective for the latest round of virus variants.
Well, Anne-Marie, first of all, 3 years into the pandemic, and you said monoclonal correctly, so kudos, that's good. Unfortunately, the virus changed, and we had a number of monoclonals, which are kind of one-shot wonders, that if you got that would temper down the virus, and you were able to have much less symptoms, no severe illness and hospitalization. With the virus changing, we do not presently have any monoclonals that work. So the only thing that works at the present time is Paxlovid if used early on in the infection.
All right, Dr. Agus, the next question deals with long COVID. The person is suffering from headaches, exhaustion, and they want to know what treatments are available for long COVID.
This is another, downer. Long COVID is real. Long COVID is happening in a number of people who've had COVID-19 infection, and we have no treatments at present that will affect long COVID, unfortunately. The difficulty with long COVID is there's no diagnostic test, there's no parameter to measure, and it's always hard to develop a drug when you don't have something to measure. The symptoms, fatigue and difficulty, thinking, et cetera, they're very generic symptoms, if you will. So many times it's hard to distinguish, is this from COVID infection? Is this from something else? But right now, there are no treatments yet. There are trials ongoing, but nothing looks extremely promising at present, unfortunately.
All right, Dr. David Agus, always great to talk to you, my friend. We'll see you next week.
You got it.